I'm Dr. Mahi Yadagiri from Stanwell and West Birmingham Hospitals NHS Trust, Birmingham, United Kingdom. Thank you for taking your time to review the final results of our EndoBarrier in diabetes with obstructive sleep apnea research study. I don't have any disclosures. On this slide, I wanted to touch briefly on the obstructive sleep apnea background, which is characterized by recurrent episodes of upper airway obstruction. We know that obesity imposes mechanical loads, predisposing OSA by following anatomical alterations like increase in neck circumference, higher upper airway collapsibility, and reduced lung volume with central obesity. Moderate sleep apnea is defined by apnea-hypopnea index with 15 to 29 events per hour on sleep studies as per NICE criteria. Both moderate and severe sleep apnea are treated by continuous positive airway pressure machine wearing face mask overnight. And this is not comfortable to wear over the night by the patients. EndoBarrier is a relatively new device which has been proven to reduce both weight and improve diabetes. And our NHS service, along with the revised study, have shown this in our center. EndoBarrier is a 60 centimeter long tube-like structure open at both ends, inserted endoscopically, which is deployed in the small intestine and removed up to 1 year later. End-OSA study is an NIHR sponsored research pilot study to explore the extent to which the weight loss associated with EndoBarrier treatment impacted on the need for CPAP in patients with moderate obstructive sleep apnea. These are the inclusion criteria for the study, and on the right hand side you can find the baseline characteristics of 12 patients who are already on CPAP recruited from our respiratory sleep service. As you can see, all of them have a higher BMI. This is a study schedule with a 3-monthly follow-up at diabetes clinic, wherein they have consultation with the physician, diabetic specialist nurses, dietitian, apart from the blood tests, observations, urine tests, along with the sleep studies. This is an important slide of the talk, which shows AHI index on the y-axis and the follow-up on the x-axis. It is worth stating that all the 12 patients during the year of EndoBarrier dropped below the AHI threshold of 15, such that they no longer required CPAP. But after removal of the device, 2 of the patients no longer attended follow-up, so we only have a full 2-year data on 10 patients. As you can see, by the end of the year, after removal of EndoBarrier, 5 of the patients stayed with the AHI below 15 so that they could continue without the recommendation for CPAP. But unfortunately, 5 of the patients put some weight back on and the AHI went over 15. Therefore, they were advised to go back to CPAP again. However, 2 of these were so keen to continue without CPAP that they put in the effort and lost again weight, such that at 32 months, 7 of the 10 patients no longer required CPAP. On this slide, you can see the consistent metabolic benefits in improvement in HbA1c and weight. We do have 2 serious adverse events wherein 1 patient required inpatient hospitalization for acromegaly, which is not related to EndoBarrier at all, and another one had a small esophageal perforation during EndoBarrier removal, which was managed conservatively. All of the patients' health status continued to improve during the study as shown by EQ-5D questionnaire. To conclude, there were major benefits of EndoBarrier in allowing 70% of patients with moderate obstructive sleep apnea to discontinue CPAP therapy. There was a sustained and significant improvement in HbA1c, weight, and generalized health status. And I would like to thank all of my colleagues above for their work in completing this study. And thank you for listening and viewing this final results of our study.